All right. Welcome, everybody. Thank you so much for joining us today. My name is Christy Moore, and I'm the Family to Family Health Information Center program lead with the Exceptional Children's Assistance Center. And today, thank you for joining us for Transitioning to Adult Healthcare, How Students and Families Can Prepare. This webinar is being presented by Annie Schmidt and Samhita Ilango from the National Alliance to Advance Adolescent Health and GOT Transition. I personally am super excited about this topic. This is such a big topic. And it's one that, requires a lot of preparation and a lot of planning. And personally, my oldest daughter is turning 18 on Friday. That's scary and exciting all at the same time. And my youngest just turned 13 at the end of October. So we're just kind of starting this whole planning transition journey with her. So personally, I'm right in the middle of all of this. So we're really excited to have them come share all of this information today. I do want to let everybody know that we welcome your questions and we really hope you have them. I'm probably going to have some questions too. Please put all questions in the Q&A as you think of them versus the chat, just so we make sure that we see everybody's questions and that we can address those. We will address questions at the end. So we're going to let our presenters get through all of their material, and then we'll do Q&A after they're done. I will launch an evaluation poll after they finish presenting their material. It'll be a very short multiple choice 4-question pop-up on your screen. We really appreciate if you just take a few minutes to answer those. Thank you so much. And also wanted to let everyone know that I will send out a follow-up email in the next day or two with information from this webinar, a link to the recording, PDF of the slides, and maybe if there's any other information that the presenters would like to share with all of you. But I have taken up enough time. I will go ahead and turn it over to Annie and Samhita. Take it away.
Great. Thank you very much. So thank you again for joining us this afternoon to listen to our presentation. We're going to talk about resources for students and families for them to use to get ready for the transition from pediatric to adult healthcare. So I'm going to start by just providing a little bit of background information about transition and then summarize a family toolkit that we created with our family advisory group. And then we will discuss some resources that we have for students. So here's just some information about GOT Transition. So Samhita and I are with the National Alliance to Advance Adolescent Health, which operates GOT Transition. And this is the National Resource Center on Healthcare Transition. And our aim is to improve the transition from pediatric to adult healthcare through the use of evidence-driven strategies for clinicians and other healthcare professionals, public health programs, payers and plans, youth and young adults, and parents and caregivers. We have 3 objectives for today. So we hope that the audience can learn the importance of healthcare transition, be able to identify healthcare transition tools that are available for students and families. And also we want to discuss additional ways for people to prepare students and families for a transition. So these are the overarching goals of healthcare transition. The first is to improve the ability of youth and young adults to manage their own health and healthcare and to effectively use health services. And the second is to ensure an organized clinical process is in place in both pediatric and adult practices to facilitate the transition preparation, transfer of care, and integration into adult care. And this is a process that is called the 6 core elements of healthcare transition. And it includes tools that people can use while they're preparing for transition on the pediatric side, during the actual move from pediatric to adult care, that's the transfer of care, and then during the integration into adult care as the young adult becomes accustomed with their adult practice and continues to receive care from their adult provider. We have conducted a few systematic reviews on interventions and outcomes associated with a structured transition process. And we have found that When a structured process is in place, youth with special health care needs are more likely to show some improvements in health, which could be measures of adherence to care and quality of life. They're more likely to show improvements in patient experience, such as satisfaction with care, and they're more likely to show improvements in utilization of care. For example, a decrease in hospitalizations, a shorter length of stay in the hospital, and an increase in visits with the new adult provider. And these three organizations, it's the American Academy of Pediatrics, American Academy of Family Physicians, and American College of Physicians. They released a clinical report where they recommend that all youth, both with and without special healthcare needs, receive the structured process called the 6 core elements of healthcare transition. So again, that involves the transition preparation, the transfer of care, and the integration into adult care. Okay, so now I'm going to show a video that just provides, it's a short video. It provides just some background about healthcare transition. Hopefully it works. There we go.
For many young adults, transitioning to adulthood can mean going to college, finding a job, or moving out on your own. This can be exciting, but also really challenging. One transition that you may not have thought about is healthcare transition, or HCT, which means moving to an adult model of care where you are the main person in charge of your health. HCT is not a single event. It's a process that can take several years. Learning about your own medical history is the first important step. So ask your doctor how to access your health information. A major part of HCT is learning to manage your own health and healthcare. To start, you can make your own doctor's appointments, fill your own prescriptions, and talk with your doctor alone. After you turn 18, your doctor can only legally talk to you about your health. Your health information and medical records will be kept confidential. It is up to you to make your own health choices. You can decide, for example, if you want your parents to see your records or be in the doctor's appointment with you. For those who see a pediatrician, HCT also means moving from your pediatrician to an adult doctor. This usually happens between the ages of 18 and 22. Some people see a family physician or a doctor who sees patients throughout their life. If you see a family physician, you'll need to change who makes your health decisions, but not your doctor. In an adult model of care, you, and not your parents or caregivers, are in charge of making decisions about your own health. To plan for this transition, talk to your doctor and ask them about their policies. If you see a pediatrician, ask them when you need to leave their practice. You can also ask them to help you find a new adult doctor to move to. HCT is all about independence and empowerment, so be proactive. Find an adult doctor who is accepting young adults into their practice and takes your insurance. And don't forget to encourage your friends to be proactive about their healthcare transition too. For tips and resources to make your healthcare transition as smooth as possible, go to gottransition.org.
Okay, so that's just a video that we put together that just gives a brief overview of healthcare transition, just in a different format than like reading information about transition. So it's on our website. If you want to look at it again or share it with anybody who might find it useful, you can find it at gottransition.org. So now I'm going to summarize the family toolkit that we created. So again, this was created with our family advisory group, and the organizations that were represented on the group are listed here. The toolkit is available in both English and Spanish, and there are links to both of those versions right there on this slide. This is just the list of tools that's included in the family toolkit. And after I go through this list, I'll show you a few examples of the tools. So one of them is a healthcare transition timeline. that has some helpful steps that both youth and families can take throughout the transition process. And I will show you some examples of steps on the next slide. We have a one-pager that summarizes the clinical recommendations. So that's what comes from those 3 professional organizations in their clinical report, the AAP, AAFP, and ACP. We have a couple one-pagers with some questions that youth and parents or caregivers can ask their doctor about transition. And I'll show you a few examples of what those questions are. We have a one-pager that shows how the parent and youth roles change throughout the transition process as the youth gradually takes on more responsibility for their own care, and the parent moves from really providing the care to being more of a supervisor. And there is a tool from Charting the Life course. This is kind of an assessment that youth and their parents can take to see what areas of life they might need help making decisions in. And then there's a one-pager about turning 18 that has the big changes that happen in healthcare when the youth legally becomes an adult at age 18. And then the next 2 are some resources that show the differences between pediatric and adult care. I will show you one of those. And then there's a transition readiness assessment that youth and parents or caregivers can take to see how ready the youth is to transition. And lastly, there's a link to a healthcare transition quiz that's available on our website. This was created with our youth and young adults advisory group. And it's just another way to see how ready the youth is to transition, and also how ready the parent feels their youth is to transition. So again, the timeline has some helpful steps to take at different stages of transition. We have a timeline for youth and young adults and one for parents and caregivers. And I'm just going to show some examples that come from the parent and caregiver version. So the transition process starts around age 12 to 13. And just one step that parents or caregivers can take is to encourage their teen to ask their doctor questions about their own health. And then at ages 14 to 15, they could help their teen practice making a doctor's appointment and ordering prescription refills. At ages 16 to 17, parents or caregivers can work with their teen and the doctor to make and share a medical summary. This medical summary will eventually get shared with the adult provider before the first appointment with the adult provider, so that they have the relevant information that they need. And then at ages 18 to 21, the parent or caregiver can encourage their young adult to ask their current doctor to help them find a new adult doctor, while making sure that the new doctor accepts the young adult's insurance. And the parent can also help them learn if there are any charges or copays at the visits. And then lastly, at ages 22 to 25, the parent can encourage their youth to get care from their adult doctor, continue learning to manage their own health and healthcare, and also update their medical summary with the adult doctor. And now I'm just going to show you a few examples that come from the tip sheets with questions to ask your doctor. So we have a version for youth and young adults, as well as one for parents and caregivers. This comes from the parent caregiver version. So there are some questions that they could ask their child's doctor, their pediatrician, during the adolescent years, such as at what age does my child need to change to a new doctor for adult health care? And then there are some questions to ask closer to the time of transfer, such as, do you have any suggestions of adult doctors for my child to transfer to? And then in the youth young adult version, there are also some questions that they can ask their pediatrician during their adolescent years, such as when do I start to meet with you on my own for part of the visit to become more independent when it comes to my own health and healthcare. So it is recommended that all youth do have some time alone with their current doctor, their pediatrician. So they learn to start to ask questions about their health, be able to explain their health needs to the doctor. And then there's some questions to ask the new adult doctor before scheduling their first appointment, such as, do you take my health insurance? Do you require any payment at the time of the visit? And then there are some questions to ask after the appointment has been scheduled, but before actually attending the first visit with the adult doctor, such as, did you receive my medical summary from my pediatric doctor? And here is a screenshot of the Turning 18 tip sheet that's in the toolkit. It shares the important information about changes that happen when the youth becomes a legal adult at age 18. So it's just important to understand how this change will impact their healthcare. So it just shows the changes that will happen in terms of privacy, confidentiality, decision-making, and sharing medical information. So with those last two, if they need help making decisions or sharing medical information, it just shows what they need to do. And this is one of the tip sheets about the differences between pediatric and adult healthcare. So it shows how the youth's care will change when they move from pediatric to adult care. And the idea is that youth can look at the changes, circle any items that they might have questions about, and discuss any questions or concerns with their doctor. So just an example, the first one, it says that in pediatric care, your parent or caregiver is with you for most or all of the visit. Whereas when they move to adult care, it shows that you will see the doctor alone unless you agree for others to be present. So again, they can look through this list, see if they're concerned about anything, and bring those concerns to their doctor, their current pediatric doctor. And then there are also some tips on the back of the tip sheet that are just tips about also preparing for the move to adult healthcare. And then there are a few transition readiness assessments in the toolkit. This one comes from the 6 core elements of healthcare transition, and it's a version for parents and caregivers, while there's a similar version for youth and young adults. The idea is that the youth and their parent or caregiver can go through this assessment and see what skills that they already have or what they might still need to work on. And then depending on their answers, they can work with their provider to start to learn these important transition skills. Oh, before I go on, there's also in the toolkit, there's a couple of versions that have been customized specifically for youth with intellectual and developmental disabilities and their parents or caregivers. And then lastly, we have these quizzes that are on our website. One is for youth and young adults, one is for parents and caregivers. And it's just another way to see how ready they are to transition. So it's a shorter quiz than that transition readiness assessment. And then depending on their answers to all the questions, at the end of the quiz, they'll get a list of helpful resources. And there's the link to the parent caregiver version and a QR code so you can access the quiz. And I just wanted to show you where you can find all these resources. So if you go to gottransition.org, We have a parents and caregivers page. This is what it looks like at the top. And then if you scroll down, you'll see all of our top resources, which include that family toolkit, and a few others, including that video that we watched. And most of our resources are available in both English and Spanish, which you can see on this page. So now I will turn it to Samitha to talk about some resources for students.
Thank you, Annie. Hi, everyone. My name is Smitha, and I'll be going through some resources. And again, if you have any questions, just drop them into the Q&A box and we'll be answering them at the end. So first off, I just want to reiterate the importance of healthcare transition planning. And I'll be walking through some tools that will be used more under the lens of a school setting or in an education setting. So as we all know, healthcare transition is a very important part in all areas of that post-secondary life. So that includes post-secondary education, employment, and independent living. And Annie, I'll actually have you click a couple more times. As you can see here, often health is not thought about when you are planning for post-secondary education, independent living, and employment. But it really is a critical piece to the puzzle. Health informs and affects all these areas. And so it's really important to keep that in mind as you help your youth or young adult think about these next steps, because all of them are so interconnected. We've done a lot of research on the lack of healthcare transition planning in school settings, and we really are trying to elevate the importance, as it is extremely important, especially for that piece on independent living. If you're not able to understand your health needs and think about how your health affects your life, it is very hard to live independently. And we really think from a young age, around 12 to 14, is a good time to start thinking through that. Next slide, please. One of the tools that we've developed to help elevate healthcare transition in a school setting is collaborate with a group in Virginia called PETC. You might have heard of them. They have a really awesome website with some great resources. And we created a healthcare transition checklist. And this is based on the PETC's organization, their life skills checklist. And I know it's really small here, but we can provide these links in a follow-up email, and you'll also have these slides. But this healthcare transition skills checklist allows you to think through different healthcare skills that make up healthcare transition. And you, and in partnership with your youth or young adult, can go through each of these skills that are listed on the left column and mark them as something that mark them as an item that your youth or young adult can do already, or they need some more practice with that skill, or they plan to start learning that skill, or is it a skill that needs ongoing support? And if so, who is the support person? This is just a great discussion tool as well. It's not something that necessarily is scored on or quizzed on. It's just something to help think about what components make up healthcare transition. And it's also in plain language, so it is a very easy to use tool. Next slide. I think we go through some examples on how to use that checklist. So this can be part of regular transition planning meetings with students if your student is in a special education setting and has an IEP. If anyone knows of curriculum for special education teachers, this checklist could get incorporated into their curriculum. If there's any family education opportunities, this checklist is very helpful. And if peer mentoring is a program that it is part of your organization or your family network, this is a tool that could be really nicely used for. Next slide, please. At GOT Transition, we have also developed two other tools that we'd like you to think about today. We did this in partnership with Washington, D.C.'s Community of Practice on secondary transition. So both the tools I'm about to show you received extensive input from special educators, the DC city officials, families, and we definitely took our time creating these tools. I think they took a couple years from start to finish just to get all the right words and language pieced together. The first tool that I'll walk through is a healthcare transition readiness assessment, similar to the ones Annie had shown you before, but this has been modified for those in special education and those that have an IEP. And it really works hand in hand, the two tools together. So the second tool I'll show you is sample goals that can be incorporated into your child's IEP transition planning documents. And the sample goals correlate with the readiness assessment, and they're all specific to healthcare transition. So we will walk through those. No, thank you. Again, also, all of these tools are free and ready for you to use, print, download, whatever you'd want. So once you get these slides, you can access the links embedded into the slides, or just visit our website where all of these exist. So the first is the Healthcare Transition Readiness Assessment for the students with an IEP. So you'll see up at the top, there's some directions. This is something that can be completed. The student can do independently or in partnership with you or another caregiver or their teacher. You will see the first section in blue is on personal care and use of communication supports. This not only allows the student to know exactly what their needs are, but it also serves for a conversation starter if this discussion hasn't happened yet. The second section, similar to the other readiness assessments, is a scale from 0 to 10 about the youth's transition importance and confidence. So how important is it to them to move to a doctor who cares for adults, and how confident do they feel about that transition? This scale, there is no right or wrong answer, but it's just an opportunity to gauge how comfortable and how confident a student is. Over time, it would be great to see these numbers move up, but it's also, a good place to start. The next section under My Health lists out different health skills. And the idea here is that a student can read through each of the skills and mark, yes, they know this, they know how to do this item. They want to learn how to do this item, or no, they don't know how to do this item. Again, there's no wrong answers. And similarly, there's a section on my medicines. So the topics here are, I know the name of my medicine, or I know how to get a refill. And similarly, you mark, yes, I want to learn, or no. And here, the idea is the items that are marked, I want to learn, or no, those are the items to really focus on and work on over a course of time, whether this is being used, each semester or a few times a year. This is something that can be worked on, each of these skills. Next slide, please. That second tool I was talking about, the sample goals, this tool really works off of that first readiness assessment. So you'll see here, the left column of this document has each of the skills from the My Health section. And then on the right column, we've drafted a sample goal for you. So if a student has, one of the readiness assessment items, as in I want to learn or a no, you can just see across, look at that sample goal. You can use the sample goal as is, you can edit it, you can fill in that blank that we've put in for the % accuracy, customize it as you need, but it just gives you an idea of what a sample goal could be for that transition plan. And next slide, please. Similarly, we have that section for the My Medicines pieces from the readiness assessment. So those My Medicine section from that readiness assessment on the left column, and then sample goals are drafted on the right column. Next slide. So I'm going to walk through an example of how to utilize the document just to make it really clear. So here we have the readiness assessment. And if you go to the next slide, I've pulled out here one of the items from the My Health portion. So the student here has marked no on I know or I can find my doctor's phone number. So we pulled that out, we've highlighted it. And if you go to the next slide, one more time. So we are looking at the example goal setting sheet. We're looking at that My Health column. We look down to find that item, and it's there halfway through. And I've circled it here, but the sample goal drafted is by the end of the IEP cycle, student will name and identify their doctor in their phone when asked with blank % accuracy. We've tried to create these goals to be realistic and doable. But again, you can always modify this if this goal doesn't relate well with your youth. Next slide, please. So here are a few ideas to attain this goal. So in that transition plan, if this goal is put in, what are you supposed to do with it? Well, you can work with your youth or young adult to add their doctor's name and phone number into their phone contacts and make sure they know how to access that. Got Transition also has a medical ID resource where you can follow steps to add your health information, medical information, emergency contact information into their smartphone. So this is for iPhones and Android operating phones. And once either of these items are done, you have to practice using either route to locate your doctor's phone number. If your youth has multiple doctors, there's room for that as well, so you can practice that. And that's just a few ideas to get this skill practiced on, and then eventually when they complete their subsequent readiness assessment, it might be interesting to see if they've marked the skill as something they know at this point. Next slide, please. We've also been working quite closely with school-based health centers, who in many states are the primary source of healthcare for students. And we've worked with school-based health centers to help them offer transition supports to their students that they serve. School-based health centers are well positioned to offer transition services just because they have ongoing care with a lot of the students. And students are often actively engaged and like their providers from school-based health centers because they built a lot of trust with them. It's often separate from their home life, so they can feel independent going to see their providers at the school-based health center. And it's a nice community. We've partnered with them a couple years ago to create a playbook, and the playbook is a guide for school-based health centers and any other school staff, or you can even think of like school nurses who assist students to help them prepare for the transition from that school-based health center pediatric care to adult health care, which they'll eventually have to see after they leave high school. The playbook has 4 sections to guide this process. And the 4 sections include one on starting a healthcare transition process, a second section on all the healthcare transition intervention tools that you can utilize. The readiness assessment that we've shown today is in there. We've also done a Q&A with 2 states, Connecticut and Michigan, who have incorporated these tools into a lot of their school-based health centers. And we asked them how their process was and what exactly did they do to get this off the ground. So that's the examples from the field section. And finally, there's an additional resources section where we've categorized a lot of different items that could be helpful for any school-based health setting that wants to incorporate transition into their program. And that again is free and available on our website to just browse through. And we did have an extensive advisory group lead this project, which was comprised of school nurses, school-based health center staff, 2 young adults, and transition experts. Next slide, please. So at this point, we're going to pause so we can hear all of your questions. I know I saw some come in, but we want to thank you. And also, if you need to reach us further down the line, both our emails are listed there, as well as our social media accounts. Our website is pretty active with updates as well, so you can sign up for our email blasts, which come out periodically on gottransition.org. Thank you.
Great. Thank you so much for sharing all that fantastic information. The website really is fantastic to go through and look at all the resources. And I apologize if you mentioned this, but that they're in English, and almost everything I think is in English and Spanish, and that
Yeah.
you have resources that are kind of targeted towards families, towards the youth themselves, and then towards professionals and stuff.
Exactly.
Let's see, we do have a couple of questions. Let's see, we're going to go to the Q&A to look at those. Oh, you know what I said I was going to do? I said I was going to launch the poll first, and I'm going to go ahead and do that. If you guys wouldn't mind just quickly answering a couple of these questions. They're in English and in Spanish. But if you could just answer those questions real quick for us. ECAC is largely funded by grants, and our grants do require us to collect information on the services and everything we do for families and professionals. So we really appreciate your feedback. Okay, so now we can jump onto questions. Okay, first one. Will you discuss when the child transitions to adult health care if the child is not capable of making adult decisions? My son has Down syndrome and has developmental delays and is incapable of making life decisions.
Thanks for sharing that. Annie, I'll take a first stab, and if you have more to add, jump in. I think there are two resource centers I would direct you to, and thank you for asking this question. We would probably recommend you talking or looking at the National Resource Center for Supported Decision Making. Their website has a lot of tools on self-advocacy and decision-making and guardianship that I think are very relevant to transition. And we have a good relationship with the Supported Decision Making Center, and they know all about this transition. So I really do think they've created some language that can help you. We don't have specific tools to refer you to, but I do think they are on that website. And that website, I can put it in the chat, but it's supporteddecisionmaking.org. The other resource center I will plug here is Quality Trust. Quality Trust is a DC-based organization for individuals with disabilities, primarily those with intellectual or developmental disabilities. Their focus is also on guardianship and supported decision making, and they are also very well aware of the difficulty of transition and the variety of people going through transition, and their resources are exceptional. And while it is a DC-based organization, their resources speak to those DC and beyond. So I would recommend both of those. The website for Quality Trust is dcqualitytrust.org, and I'll put both of those in the chat.
Thank you. And I'm writing as you're speaking and mentioning all these wonderful things. I am writing down a list of resources and links to send along with. One of the next questions is, I hope we get a link to the recording. Absolutely. We are recording this. I will send a follow-up email with a link to the recording, a PDF of the slides. And as we go through questions and some of these great resources are brought up, I will send links to those resources in the follow-up email. Oh, great. Thank you. And
before we go to the next question, I just want to add another resource center you could potentially look at is the National Down Syndrome Congress. They have many resources for people with Down syndrome, including a recording of a webinar that was kind of similar to this, but it also included a parent of a youth with Down syndrome, and she talks about her own experience with transition. And then one other resource, we are working with Family Voices. They received a grant from the ACL to lead a national resource center for youth with intellectual and developmental disabilities. And we, on December 1st, we're going to be launching a new website that we created with a youth steering committee, and that's going to have a lot of transition related resources that are specifically for youth with IDDD, their families and clinicians. And if you sign up for our listserv, I think I'll put the link in the chat, but you'll get an email for when this website is live.
Fantastic. Thank you so much. Okay, let's see. Next question is, where would or could these goals go on IEP? I feel like the school would say it's not in their purview because it's not school related. What is the best way to advocate for adding these?
That's a really good question. And, we've kind of struggled with that barrier where schools say it's not part of their regular IEP format. And our biggest push for advocating for this is to speak with your special educator or whoever's in charge of the IEP program and have them add this into the independent living section of the IEP. While there isn't a specific healthcare transition section, if you look under the United States constitutional regulation for special education, independent living, the definition can extend to healthcare transition. And we've argued that a few times in some school settings, and they've allowed healthcare transition goals to be added within that independent living domain. While it would be great to have a separate health domain, I know that's not realistic. So I think for now, I would recommend you advocate it being added into that section because healthcare transition really affects independent living.
Thank you for that answer. This is Brittany Cutshaw speaking. Can I add to that just a bit?
Sure.
Thanks so much. So for any of the participants who are in the audience, ECAC can help you with those transition goals around the transition to adulthood and implementing some ways to strategize the communication with the IEP team and how the healthcare transition really does relate to the individual's functional performance. So if there's anybody out there who would like to speak with one of us about that, feel free to get in touch with ECAC and we can discuss that further.
Fantastic. Thank you so much, Brittany. And that is very true. You know, part of the transition is to prepare them for life outside of school. And healthcare transition, I mean, you have to be healthy to learn, you have to be healthy to work. You have to know how to take care of yourself or have some sort of plan in place to be continued to be taken care of. So it absolutely does relate. And like Brittany said, please feel free to reach out if you need support with incorporating that into your child's IEP. Let's see. Next question is, does guardianship majorly affect this transition?
I think it can, but again, I think most people's experiences with transition are quite unique, and so guardianship can affect that. I would refer you to the Supported Decision Making Resource Center to learn a bit more about that. Our focus isn't necessarily on that guardianship transition difference piece, so I would refer you to them.
Okay, perfect. Let's see. Next question is, what can you suggest for an adult with a disability who has a difficult time remembering to contact doctors or pharmacy for appointments and refills?
Yeah, I think one of our colleagues who co-directs Got Transition, her name is Patience White. She is a pediatric and adult provider. I've heard her before say that it's really important for caregivers to really be on the youth about putting reminders into their phones, alarms, teaching them the skills to remember. And then at a certain point, I think they also just, I think she once said a story where she's like, a patient just didn't have their medicine, and that's when they realized they really needed to be on this and they have to do it themselves. So I think just teaching them the skills and practicing the skills and making sure they know if they don't do it, they just don't have their medicines or their appointments. It's just really important. I'm not sure if I have any other better tips. Annie, if you have any other suggestions? No. Okay.
No, I think the putting reminders in your phone is a good one.
Yeah.
Okay, and there was, let's see, let me hop over. Make sure all these are answered. Oh, another one popped up. Let's go to the chat. I think somebody had a question around school-based health centers. Sometimes
yeah.
things get get lost in the chat. That's why that's why it's nice for folks to put their questions in the Q&A so we can make sure that we get everything addressed. But I mean, if you want to take that, explain what school-based health centers are.
Yeah. So the question is, are those standalone clinics or are they integrated within actual clinics? So school-based health centers usually operate as clinics embedded into the school. However, they're not run by the school. They're run usually by a local hospital or a local health system, and they're usually funded by the state, as well as that local hospital. They're not found everywhere. So I know in Washington, D.C., they are pretty prevalent, but I think again, it's state dependent, but I know every state does have them. I know the School-Based Health Alliance is the organization that really helps connect a lot of the school-based health centers. So if you go to their website, I believe they have more information about the School-Based Health Center program, but it is independent of a school nurse office or a school clinic. It's usually a pretty robust health clinic that's integrated within the school setting.
Yeah, thank you. And I've actually had the opportunity to go visit a school-based health center in Durham that was actually in one of the high schools in Durham. And I just had no idea before that those actually existed. And it's just such a wonderful concept. And I can send out a link to the official website for information on North Carolina school-based health centers. But basically, it's just designed to increase access to physical and mental health with a target age of 10 to 19-year-olds, and that they're actually located in or near middle schools and high schools to help with physical and mental health services. And I'll send a little bit more information on exactly what those are. And, you know, maybe you can find out if you have a school-based health center near you. Or in your child's school or near your child's school. I also see that Carrie shared, and this, I wrote this down on my list. I love this resource. North Carolina has Rethinking Guardianship. It's a great website with lots of wonderful information. So thank you, Carrie. We're definitely going to include that link into the follow-up information. And if anybody else, I know we have a lot of audience members here that have a lot of great ideas. So please feel free to drop something in the chat and I will be happy to share that with the entire group. Let's see. And I think I got a notification that somebody had their hand up at some point. I don't know if that person still has a question or if it was answered or if you'd like to. Okay, let's see. Are you guys okay if I let somebody unmute and ask a question?
Sure.
All right, let's see if I can get them permission to talk. All right, Holly, you should be able to talk now. You'll need to unmute yourself first.
Actually, you guys really answered my question because I was really thinking about the school-based side of it in terms of how we make this part of the parent training side of things in terms of, I mean, because we know parent training is part of it too in that transition plan. So we know Voc Rehab gets pulled in, you know, and other resources. But those transition, you know, centers, I think I'd love to learn more about those so we can really make those utilized the way they need to be utilized. Because I think transitions within our schools are definitely one of the bigger challenges.
Yeah, I agree. I agree for sure. And it's hard. And I was telling the presenters before we went live and started recording, this is just such a big topic. And I have a little bit of base knowledge and I'm familiar with a lot of these resources, but it still feels so big to me. And I will rely heavily on, you know, the school to help support my daughter, especially my younger one, who has autism and a genetic disorder on transitioning. And right now with my 18-year-old, she does have some special healthcare needs, but just in the area that I live in, you know, knowing all of this stuff and transitioning to adult providers is fine, but we're also dealing with the issue of, you know, who accepts your insurance, who's taking new patients, you know, how far away are they and how long are their wait lists, especially if you have to see any kind of specialist. So there's a lot of different things here that kind of go along with this transition to adulthood and healthcare transition to adulthood. So That's why I'm just glad we could start, this conversation around this topic and continue to learn. And it feels really big and complicated, but hopefully you guys learned something today and learned a little bit more about some resources that might be able to help you prepare for this transition. Let's see if there are. Allie said, some pharmacies will send out reminders when it's time to renew or will allow you to autofill. Assisting use with setting this up may be helpful. Yes, that is definitely true. And that's true, like with the pharmacy thing, like it's okay to ask. And it even might, like with the pharmacy asking about this autofill, and if they don't have it, asking, well, mentioning, that maybe this feature would be helpful for, young adults who have disabilities, and just helping them think about making this stuff more accessible. Because it just might not be something that's on their radar. So perfectly acceptable and important, I think, to bring that up. Let's see. I don't think there's anything else in the chat. Let me check the Q&A one more time. I believe we have answered all the questions that were in the chat and in the Q&A. So does anybody else have any other questions that they'd like to get in? And if not, okay. Oh, let's see. Jennifer had a comment. She's developing an education clinic for families of kids with autism to talk about transition. I know that so much of this will be helpful, and I look forward to digging more deeply into all of them. Thank you. Yes, there's a lot of variety of professionals all across the state who are looking at this and doing work around this. And it is such a big topic. And I'm glad to see all the work that's being done. Thank you, Jennifer, for adding that comment.
And Jennifer, if you're still here, we have a tip sheet for integrating young adults with autism into your practice. And this is a tip sheet that we created for adult healthcare clinicians. I'll copy the link into the chat for you because I think that could be really relevant.
And I'll include that link in the follow-up email as well. You're going to put it in the chat?
Yeah, right
Okay.
now.
Ah, fantastic. This is great. Thank you so much. Okay, great resources. Okay, everyone. Well, if we don't, I don't think we have any more questions. Do either of our presenters have anything else that you guys want to end with, mention?
No, but thank you to everyone who came out to listen today.
Fantastic. Yes. Thank you guys. Thank you, everyone. I know your days are busy. I will send out a follow-up email. I have to get this recording downloaded, and then I have to get it posted to YouTube. So if I don't get a follow-up email out, it probably will not be today. It will probably be tomorrow. So be on the lookout for that. PDF of the slides, link to the recording, and then links to all of these fantastic resources that everybody has mentioned. Thank you so much, everyone, for joining us today, and we hope to see you again soon. Take care. Bye-bye.